This is Dr. Phil Davidson with Davidson Orthopedics. Today I'd like to speak with you about joint resurfacing of the knee. Joint resurfacing really falls in two categories. We could do either biologic or prosthetic, and today we're going to focus on the prosthetic resurfacing. Prosthetic resurfacing, as I see it, as I explain it to patients, is three types. First is inlay resurfacing, second would be an onlay resurfacing, and lastly would be a total knee arthroplasty or a total knee. So now let's talk about inlay resurfacing. Inlay resurfacing, which is the least invasive method, involves putting in metallic inlays, they come in different shapes and different sizes, into the joint surface. I like to think about this and explain this much like repairing a tile on a kitchen floor. Rather than ripping out the whole floor or switching out all the tiles, just replacing the broken tiles. And so in this instance, we have it on the medial condyle and under the patella. The patella itself can also be resurfaced with an inlay. The inlays come in different shapes and sizes, and for that matter can be done in different joints. And here we see different sizes on the femur. The next type of implant is what I call an onlay arthroplasty or an onlay resurfacing device. And in this instance, an onlay allows us to build up the joint. These implants are custom made, and the beauty of this is that no bone needs to be removed at the end of the femur, and the implant, which is custom made and manufactured through 3D printing, fits precisely on the bone. And in this instance here, we can see it works on the tibia and the femur, and that's an example of an onlay. These come in different shapes and sizes as well, depending on what's needed, and this is an example of an onlay that goes for the front or the patellofemoral and the medial side of the knee. And these components cover the tibia as well. The last type of resurfacing is a traditional total knee replacement. And what we see here is that the femur is replaced in its entirety, the tibia in its entirety. And with this type of surgery, we can restore alignment, we can restore stability, and this would be appropriate in certain situations where all three parts of the knee, the medial, lateral, and patellofemoral, are all affected by degenerative changes. So in summary, there are three types of joint resurfacing: inlay, onlay, and total joint. It's not a matter of choosing from a menu. It's more a matter of we have different options to meet different needs. So the treatment is very customized, and choosing the most appropriate indication or most appropriate procedure for each patient is something we do after looking at x-rays, examining the patient, and looking at your individual circumstance. So for further information, I would refer you to my website, davidsonorthopedics.com, and thank you for listening.